So this is like one of those Tai Chi exercises, shoulder width apart. You want to just relax your shoulders. And like, let's say you're trying to carry a baby, right? So carry your baby and then you just bounce, right? So start off, just bounce like this. And then you can just get it even faster. You want to do this, so like hold the baby, hold the baby. Okay, for guys, when you're breathing in, your belly should actually extend like a beer belly, right? And then when you breathe out, your belly should go in. So you're gonna go beer belly, breathe in, 6-pack abs. Beer belly, 6-pack abs. Beer belly, breathe in, and a 6-pack abs. This, you're breathing out anxiety. You're breathing in oxygen, and you're breathing out that anxiety. High stress, you're gonna play the guitar. So this is gonna be your guitar string. So you're gonna find the middle of your guitar, and you're going to push. So you're gonna also push from both sides. You're gonna grab like this, right? This is for stress. When you're all stressed out, your neck, shoulders all tight. So you're gonna play the guitar. You're gonna play the guitar all the way down your arm. Press hard, okay? And while you're playing the guitar, move your head. Play both guitars and just move your head, bobble your head. I'm using my thumb on the inside and my fingers on the outside, my 4 fingers on the outside. I'm just playing the guitar, going up and down.
Currently live in Arizona, in Lake Havasu, Arizona, although my wife and I are snowbirds, and our real home is Michigan. Seeking treatment for peripheral neuropathy. It came upon suddenly. It's been maybe 3 months now, and it attacked my hands and feet, and which is a particular problem for me because I love playing guitar and bass, part of a worship team at church. Play every day, and all of a sudden I can't play at all. It became a big deal for me. It was a big jolt. Like I say, I would practice and play guitar or bass pretty much every day. I also play golf, and with the problem with my hands, the feeling in the hands, I can't really play golf. So the two things that I was doing most of the time, golf and music, were suddenly taken off the table.
Okay.
I looked at a lot of options to treat the neuropathy, and mostly ran into a lot of dead ends. I happened to see a YouTube of Jimmy talking to, I think it was the Neuropathy Alliance of Texas, and was kind of impressed with what I heard, and he opened my eyes to the possibility of acupuncture. My wife and I came here from Arizona to the clinic, and after 1 week of treatment, we have seen improvement in all areas of the neuropathy, and we plan to keep going, and hopefully, through the things that are advocated here, just severe diet changes, exercise changes, and the treatments that we're getting here, which is both acupuncture and rebuilder, and just really good advice. We feel we have found the right place to combat this neuropathy problem. Everybody that works here and Jimmy are absolutely open, seem to be really genuinely interested in what they're working on and helping the patients. Every question has been addressed and answered thoroughly, and it just happens that all of them are a pleasure to be around. We went to a neurologist, we went to a regular doctor, and frankly, we got no benefit out of that. I mean, they were able to determine that what I had was in fact neuropathy, although idiopathic. There was no reason that they could find. But as far as solutions, there were none. they would have prescriptions ready to deal with pain. We're not interested in that. We want to try to see if we can get better, get as much of the functionality back as we possibly can. I would recommend that it's in a heartbeat.
Neuropathy. So the first thing you need to do is, if you have those symptoms of neuropathy, numbness, I'm talking about consistent numbness, tingling, like constant numbness, tingling, burning, pins and needles, any of those things. First thing you want to do is you want to go to your neurologist, okay? So you want to check off that box. You want to go to your neurologist or a neurologist. And specifically, you want to try to find someone that is a neurologist that's more, I would say, that looks into nutrition also. Here in Austin, Texas, we're very fortunate. I work with one neurologist, Dr. Iris Wingrove. She is kind of like a functional neurologist in the sense that she looks at nutrition, organ function, which is very similar to the way that we look at neuropathy or in Chinese medicine at Achieve Integrative Health. So out of the way, go to a neurologist, have them do some blood work, right? You want to do some blood work. You want to do some blood work to see what's going on. Maybe there's an organ dysfunction. Maybe it's a vitamin deficiency, right? Sometimes neuropathy is also, which is rare. We don't see this as often, but it is possible with adverse reactions to a medication can cause neuropathy or nerve damage, giving you those tingling, numbness sensations, right? It can also be due to trauma, but again, the neurologist can help us rule out those possibilities to find out what is the exact cause. Sometimes we can't find the cause, but at least we rule out those causes where neuropathy is not necessarily reversible. Okay, so you want to do some blood work. You want to, some of them, at times, if your neuropathy, if it's affecting your balance, your ability to walk, then you're going to need to do something called the NCV-EMG, a nerve conduction test, to see if your large fiber nerves are actually damaged. So basically they help you balance, like your motor nerves. It's not just sensing, it's like it's affecting the way that your muscles are moving. So you definitely need that type of test, and a neurologist can do that also. So all of these steps are vital because it helps us at Achieve Integrative Health to determine how much we can help you, right? Or if we can help you or not. You have to. It's vital that you go through these steps. So find a neurologist, get up some blood work, and possibly get some nerve conduction tests. And the focus. Now, what is all this going to do? Well, the focus is on restoring function. In order to reverse your neuropathy, if it's reversible, is we have to refocus on organ function. And that's what we do here at Achieve Integrative Health. We integrate Western medicine and Chinese medicine. They all have their benefits. And so we get the best of both worlds. We integrate it together, get all the data from both, the best of both worlds. Like this is from Western medicine data. We also do our own diagnostics in Chinese medicine. We integrate those data. We put those data together and we get a bigger piece of the puzzle, right? And let's say instead of just having, let's say, one slice of information, when you do all this stuff, you can actually get more slices of information and you'll get a bigger piece of the pie into what exactly is going on with your neuropathy. The more pieces of pie that we get, then the clearer we are into helping you reverse your neuropathy, right? Yes, some neuropathy is reversible, not all, but a lot are. And so if we can get more pieces of the pie, that helps us determine what treatment course is the best in helping you restore your nerve function, right? But at the end of the day, it's all about organ function, because it's your organs that actually help you restore organ function. It's your organs that help you restore your nerve function. If your organs aren't functioning correctly, you're not going to restore your nerves, right? It's common sense. So all of these diagnostics is to pinpoint which organs in your body is not functioning correctly, and then go and fix it. And how do we fix it? It's actually very easy. We do two things, just like you need to do two things. Number one, you need to eat. Number two, you need to poop, right? So every organ in your body needs to eat and poop. And so if we can just get every organ in your body to eat and poop, it starts to function better, right? And your nerves actually start to regrow.
Contact us to schedule an initial exam today.